Social anxiety starts inward. It's often started with negative beliefs we have about ourselves and our social ability. So usually thoughts and fears that we are socially awkward, that we will offend other people, that other people will reject or abandon us, or that social interactions will always go negatively. There's a lot of discomfort around social situations, which tends to actually lead to us engaging in less social activity with time. So we start canceling plans, we start going out less, we stop talking to new people, we start only talking to a few safe people that we already feel comfortable with. Over time, this does tend to just get worse and worse until we find we really don't feel comfortable doing almost anything social at all or outside of just a handful of people. So in order to actually overcome social anxiety, we need to address a few key pieces. The thoughts that keep it going, these negative assumptions about our social ability and about interactions, as well as our actual behaviors. So the first step of challenging those thoughts can be a little tricky. The first step is honestly identifying them. So starting to write down and be aware, what are the negative social beliefs I have? What do I actually think, or what does my anxiety tell me will happen if I go to this event or if I talk to this new person? Once you've actually got those beliefs and you're more aware of them, you can then start to challenge them. I often recommend simply asking the question, what true evidence do I have that supports these beliefs? Do I 100% know for sure this person is actually upset and angry, or am I reading into nonverbal signals or even just guessing how they may feel? Another great way to work through those thoughts is to kind of ask yourself, do I hold these standards to everyone else, right? If one of my close friends were to accidentally say something that offended me or hurt me, would I instantly think they were this terrible person and end the relationship? So almost just flipping the script, right? Same with, going out, right? Would I encourage a friend to talk to themselves in this way? And if a friend was dealing with these thoughts, how would I reassure them? By slowly breaking out of those thoughts, you should be experiencing less distress and less anxiety when it actually comes to the thought of socializing. And then we move on to the next piece, which is actually behavior. Now, there's two different behaviors we tend to want to really focus on. The first one is going to be gaining new experiences. So that's actually going and trying to talk to strangers, going and making new friends, going and attending a class, going to an event where maybe you don't know anyone, or simply trying to start more conversations with the people you do. Right? It's proactively gaining new evidence to help actually feel that some of your new beliefs about socialization, maybe that it's safe, it's healthy, it's normal for it to sometimes be awkward or difficult, that all these things are actually in reality true, and that there's not so much danger and so much fear that needs to be involved in it. The other behaviors we start looking out for are something called safety behaviors. So these are actually ones we want to limit, right? Safety behaviors are things we do to kind of avoid our fear or to try to make it better, right? So things like that might be, only choosing to go out to events where we already know most people, or flaking to plans on the last minute. It might be when we go out, actually trying to stay more in the corner on the wall, or trying to not make conversation, or putting our headphones in, or appearing busy, or staying on our phone. Other safety behaviors might be always making sure I have my anxiety medication on hand, always making sure I have kind of a backup person to call to come get me if things feel too overwhelming. It might even just be leaving events early. Regardless, our goal is to make sure we're not engaging in these behaviors, right? That we're not trying to avoid, that we're not trying to separate ourselves or really feel small, and to go out of our way, right, to fully engage in more social situations without any of those safety behaviors. So no more avoiding. You can start small. So make a list of all the things you'd want to be able to do socially and start with the easiest, whether that is just replying to some of your text, inviting a friend you already know out, or going to an event you already have gone to in the past. Start small and build your way up to progressively more and more challenging social situations, and see, hey, here's what my anxiety says might happen, and then actually pay attention to what actually occurs when you put yourself out there and give it a full chance. Take those steps, and slowly but surely, you'll be working towards overcoming your social anxiety and no longer being stuck in that cycle. So social anxiety is highly treatable. You don't need to live with it for life. So start getting the help you need or taking the steps to actually overcome it so that you no longer have to live with these symptoms forever.